My name is Dr. Brian Broxbaum. I'm an orthopedic spine surgeon with the Texas Back Institute, and I specialize in all back pathology, both neck, cervical spine, thoracic spine, and lumbar spine injuries. Well, I'm originally from small town Iowa. I did grow up on a farm, and for 18 years that definitely instilled a good work ethic within me, and that served me well throughout my education. Knowing the type of work that I did growing up and the type of physical activity that it takes to be able to do those types of jobs, I got a very strong appreciation for what my patients are going through and the need for them to be able to get back to high level activities very quickly. And for that reason, one of the specialties that I focus on is minimally invasive spine surgery, which allows patients to return to work much quicker. Most often they're outpatient surgeries, and many can return to work the day after, or certainly the week after their surgery is completed. My good friend in grade school and high school, we played sports together, and his father was the coach of many of our travel team at baseball and basketball and football leagues. And he was also the general surgeon in town. And so through him, he knew that I was interested in veterinary medicine initially, and he just wanted to get me exposed to the operating room so I could get introduced to human medicine and see how important he felt his job was to the community. And through that experience, I did gain access to the operating room, which was very intriguing. It was a phenomenal experience to get that exposure at such a young age. And I also got to see how patients interacted with him and how he interacted with patients. How significant that was, not only for their families, but also so that, again, they could get back to work and to complete the jobs they needed to do to support their family and help the community. One of the reasons I got into spine surgery is because of the vast diversity of the pathologies or problems that we see. And so we need to almost investigate using diagnostic techniques, using different physical exam findings, and putting all of the information together to make the appropriate diagnosis, to make the appropriate treatments. And that process and the mental aspect of figuring out the disease to begin with and the treatment plan is really what drew me to spine surgery. The main focus in spine care in general is to treat patients and treat their disease process with the least invasive means possible. And more than 9 times out of 10, that doesn't mean surgery. And I work very closely with our non-surgical specialists, meaning our physical medicine and rehab doctors, our physical therapists, our chiropractors. The vast majority of the time, non-surgical treatments are highly effective and we can avoid any surgery. But if surgery is needed and surgery is appropriate, minimally invasive techniques, again, can significantly reduce hospitalization stays, reduce blood loss, reduce infection rate, and return to function much quicker. And we can get patients home, we can get patients back to work, get patients happy. TBI is a very well-known organization, well-known surgeons, and well-known reputation. And those are all things that I look for practice and I feel patients look for in their physicians. And I had the benefit of training with several of the surgeons within this practice, and I know them well and they know me well, and they know that I will fit in well with the philosophy of the group, and they know that my surgical practice is a great fit for not only TBI but the Dallas area. What I envision my legacy as a surgeon being is not my legacy, but my patients' legacy and their experiences with me and the type of relationship that I had with them, knowing that I am a patient advocate and that I do my best, not only surgically, but personally, to connect with patients, to allow them to feel comfortable under my care. And I want that legacy to not only be with my patients, but with their families and their friends, knowing that I was an advocate for my patients, that I did my best, both personally and surgically, to treat them appropriately and fairly and allow them to recover and get back to the quality of life with their families that they all want and deserve.